So very good evening, one of the present here. So today our ATHEENAPANDIAN team will cover the cardiology department. So what is actually cardiology department in hospitals? So cardiology is nothing but the way of we study about heart and its functions and how your blood vessels and how your blood circulations are works. So we all totally belongs with this cardiology department. It's related to your particularly the way of blockage issue, valve-related disorders, or else these kind of issues may happen in our heart-related diseases. This department is majorly focused in hospital science. So we must ensure cardiology department will be having so much crucial in this critical care. What is the reason means? Because we have so much of heart diseases may happen during the critical times, particularly heart attack, cardiac arrest, and arrhythmias, then fibrillation, then ventricular tachycardia. So these kind of problems may happen. Some of the equipments we are using over in this cardiological department. So what are all the cardiological department equipments are there and how we can classify in this cardiology? We all see more in today's session. So let's move on to the way of what are all the basics types of cardiology department is there in hospital settings. First thing we need to know that general cardiology. So general cardiology is nothing but is the way of any kind of the problems may happen due to the way of blood related issues or else the pumping related issues or else we need to check any kind of arrhythmias through this general cardiology department only. We need to check any kind of external problems may happen into our heart. So particularly, major of the problems may come in the general department, cardiology sites. They have like heart beats issue, or else the problems may happen due to the reasons of bradycardia and tachycardia. So these kind of problems may happen. This general cardiology is more helpful in this type of departments in cardiology. Then interventional cardiology. Interventional is nothing but if you're going to any kind of valve-related disorders may happen, we must remember the angiography is must to just remove the blockages or else if any kind of the vessel blockages may happen, this angiography particularly to remove the blockages with the help of stent or like that, we are using in this interventional cardiology. Then pediatric cardiology. Take example, who are all the patients under neonatal or infants. So the patients called 0 to 1 months newborn babies having any kind of heart-related issues may happen. This pediatric cardiologist is more helpful to check any kind of heart-related problems in this department. Then electrophysiology cardiology. So what is actually EP cardiology means? The patients who are all affected with the way of conduction-based issue. So conduction fibers or conduction system may happen any kind of failures. This EP cardiology is more helpful, particularly the patients who are affected the natural pacemakers like ACA node, AV node, or bundle of his, bundle of branches, and Purkinje fibers. These related, the fiber related issues, particularly the conduction systems, may happen in failure. This department is more helpful to check out any kind of issues in our heart. Then preventive cardiology. What is actually preventive cardiology means? If may happen previously 10 to 20 days before, if may happens, the patients could affect any kind of heart attack or something, the doctors could identify easily what are all the issues may happen within 1 month or within 2 months. So like that, in this preventive cardiology, to check any kind of arrhythmias, to check any kind of tachycardias, or else to check any kind of fibrillation, this department play a crucial role to analyze easily. Then heart failure and transplant cardiology. So what is actually heart failure and transplant cardiology means? Particularly for all the patients require the immediate transplantation. Most of the cardiological hospitals they have facing this kind of transplant, heart transplants, and also some kind of heart failures may happen. We just transplant our heart into one person to another person. But this thing, in upcoming days, the artificial organs also play a crucial role in heart transplant cardiology department. So because for all the patients require the immediate heart transplant during the critical situations, this department will play a crucial role while we need to ensure this all those types of department will play a crucial role during the types of cardiological department. So I need to ensure what are the basics equipments are there in our cardiology department, because we all well know about some of the minor equipments are available in the cardiology, and also we have available the way of major equipments is also there. But we must ensure stethoscope is our basic minor instruments in our cardiological department. Particularly, this stethoscope will play a crucial role to check our heart rate. So 72 beats per minute will be there. We must ensure how your valve-related problems may happen, or else if any kind of auscultation sound we need to analyze. Auscultation is nothing but to listening our internal body sounds. So like that, this technique play a crucial role to check not only for the heart rate, to analyze valve-related problems, any kind of valve-related disorders may happen. This stethoscope could analyze easily the earliest stage of valve diseases. But we must ensure the stethoscope having two types of there. One is particularly if you're going to with belt and without belt stethoscope are available in our cardiological department. Particularly in current updates, the major of the stethoscope are launched with the help of Bluetooth stethoscope. So what is actually the way of Bluetooth means? We just see about this picture. This Bluetooth stethoscope play a crucial role up to 1 lakh. The device will be cost around from 1 lakh will be there. So they're manufacturing from this Bluetooth stethoscope from Littmann stethoscope. So Littmann is a company, they have manufactured these kind of Bluetooth stethoscope in upcoming days. But we must ensure it will be connecting, it's not only to check directly to our heart, it will be available in the way of electronic stethoscope and amplification stethoscope. If you're going to some updates in current trending, they have using for transfer the data immediately to our mobile. That is called digital stethoscope. So we must ensure this type of stethoscope play a crucial role up to starting rate from 1,500 to up to the rate of 85,000 will be there in the stethoscope market price in our country. So we must ensure what is actually sphygmomanometer. Sphygmomanometer is nothing but the way of blood pressure. So it's related to the way of the BP will play a crucial role, because the top three most incurable diseases, one is this sphygmomanometer. What is the reason means? In our current trending, the patients who are affected above 120 by 80, we could call the normal range. If the normal range will be get higher than the normal range, the patients will affect hypertension, particularly 140 by 90, or else going to 160 by 90. The patients are called hypertension patients, particularly stage 1, stage 2, and stage 3 hypertension patients, because if may happen this kind of BP checking with the help of the device, you may easily ensure to prevent the heart attack, because most of the heart attack comes from this blood pressure. So we must ensure the patient's name is called low blood pressure and high blood pressure, particularly hypertension patients. You just say this device is particularly to check out through our this area. This is called the area name is called brachial artery. The brachial artery we could easily analyze the way of any kind of particularly during the time the phase 1 and phase 2 sound is major important to check our systolic and diastolic blood pressure. So this systolic and diastolic blood pressure play a crucial role to check our normal blood pressure. So systolic is nothing but during the contraction, the pressure will be get higher up to 120 to 129. The current WHO are telling about the readings 120 to 129 divided by 80 to 84 is our normal blood pressure range. Likewise, you may ensure this kind of sphygmomanometer. It's not only used in our hospitals. Now we currently using digital sphygmomanometer will play a crucial role in upcoming days. But we may ensure this sphygmomanometer is not only available in the way of digital, starts with mercury and then aneroid and then digital BP monitor will play a crucial role in minor cardiological equipments in hospitals. So, we all know about the most important trending cardiological department is electrocardiograph machine. So, what is actually electrocardiograph? So, electrocardiograph is a machine, and electrocardiograph is nothing but to study about the waveform. So, through this kind of ECG, we could easily analyze to measure our electrical activity of our heart. Take an example, if the patients are affected any kind of not only affected the way of ventricular fibrillation or something, but we may ensure this ECG device could analyze any kind of tachycardia patients or bradycardia patients, or else the patients who are affected like cardiac myopathy. Cardiac myopathy is nothing but the external heart muscles could get tightened. So this may happen, you easily analyze through this PQRST waveform. PQRST waveform is nothing but this is the output waveform we could get from the ECG. So we have to get this helpful of that thermal graph sheet. You could easily analyze any kind of rhythms may got failure, or else you could easily analyze any kind of asynchronous waveform may affect this ECG playing a crucial role. With the help of some electrodes, with the help of some clamp electrodes and suction bulb electrodes, you could easily analyze your chest rhythm, and then your limb placement electrodes. You could easily analyze the three kind of things. Particularly, we are here using three types of lead system we are using. One is particularly we currently using the most of the current trending ECGs normal machines are using 12 lead system. But if you go into the advanced equipment, they are all using 3 lead system and 5 lead system. So 3 lead system, 5 lead system and 12 lead system will play a crucial role, because major of the equipments will play under this unipolar leads and bipolar leads. So that's why you may ensure during the treatment time, we must ensure whether maybe the problem happened in ischemia like that. Ischemia means the lesser amount of blood flow in your blood vessels. So likewise, you may ensure this ECG is not only helpful to check our heart-related problems. This may happen earlier stage of diagnosis. This ECG play a crucial role to check or analyze our heart rhythms. So here, this ECG machine is not only available in the one things. We have currently the ECG machine types is particularly Holter monitor is also there. Holter monitor is nothing but we have easily analyzed through our portable base. We can take it anywhere. So Holter monitor will play a crucial role in upcoming days, because during the traveling time, this Holter monitor it would easily analyze our, with the help of 3D system or 5D system, it could easily analyze our heart rhythm. If any arrhythmias may happen, it could easily sense the signals and sense the alarm soundings. With the help of this Holter monitor, we could easily analyze the early stage of diagnosis of your heart-related failures. So then, the most of the areas in currently, most of the critical areas in hospitals, particularly emergency care and operation theatre, will play a crucial role this defibrillator machine. It's not only available in the hospital, it's also used in some of the ambulances also. So during the time, this defibrillator will play a crucial role for the cardiac arrest patients. So defibrillator is nothing but it is used to just treat our any kind of cardiac arrest patients, or else to restore our normal heart rhythm with the help of some external electric shocks to the patient. So this defibrillator will play a crucial role in upcoming cardiological equipments, because who are the patients, the natural pacemakers could get failure. We must ensure during the time the SCN node is an important thing to produce our electrical impulses, particularly 0.06 to 0.19 millivolt is our normal sinusoidal node natural pacemaker electrical impulses range. So this range may not properly comes with the help of patient. This defibrillator with the help of some paddles, particularly sternum pad and then apex pad. This paddles which is placing through our sternum area and apex area, you could easily restore the heart rhythm with the help of some external electric shocks. up to we have using here the 2 joules to 360 joules we are using in the current defibrillator machines, because we have the 2 types of waveform to apply to the patient, particularly monophasic waveform and biphasic waveform. So this kind of defibrillator will play a crucial role during the critical situations of to restore our normal heart rhythm. So this one, it's not only for the cardiac patients, it's also helpful for fibrillation patients. What is fibrillation? Is nothing but unsynchronized contraction of muscle fiber. We just converted this unsynchronized contraction of muscle fiber into a synchronous waveform through this defibrillator paddles. So with the help of this kind of defibrillator, will restore, and it's and life-carrying equipments, life-saving equipments is the one thing, is the defibrillator, because it's the critical care equipment. It's not only used in the current areas. We all using this kind of defibrillator. One type is called automated external defibrillator. What is actually AED? Because most of the public places, particularly in airports, this AEDs play a crucial role. Most of the developed countries are using this AED platform. So what is actually AED? So it's if the patients could have any affections during the public areas, this AEDs just directly sends the electrical shocks to automatically analyze with the help of the patient cardiac rhythms. So if I'm just placing the AEDs electrodes to my chest, particularly through the RSC pad electrode, you may ingest this device with the help of the automated. Automated is nothing but automatically it would analyze if may happen any kind of problems in our heart, particularly heart rhythms got failure, whether the patients having ventricular fibrillation or atrial fibrillation. Based on the patient requirement signals, it automatically sends the electric shocks to the patients with the help of some portable batteries, portable based devices we are using in current applications. So that's why AEDs also play a crucial role in current trending equipment in hospitals. Then also we have using current thing is implantable coordinator defibrillator. What is actually ICD? ICD is nothing but we just placing directly external heart muscles. They just the pacemaker or placing in your that ICD we have just placing in your heart. That time it automatically ensures this may happen any kind of heart related issues or heart related arrhythmias may happen. It automatically sends the electric shocks without the manpower. So this kind of portable based devices play a crucial role in upcoming cardiological devices. So we also using it's called the semi-automated external defibrillator. Now most of the hospitals are using semi-automated external defibrillator. It's nothing but we have to prescribe whether maybe the patients require monophasic or biphasic. This semi-automated defibrillator will deliver the external electric shocks through the paddles. So then, so here's the area that AED. So automated external defibrillator. Whether maybe the patients having any kind of heart-related fibrillations, particularly ventricular fibrillation, the QRS waveform will be not generated due to the way of the natural pacemakers could fail. That time, these kind of AEDs will play a crucial role. It automatically sends the electric shocks to the patients without any kind of manpower. So that's why now most of the areas the AEDs are using in public transports also. So we may insist what is actually echocardiography. Nowadays, most of the areas in ultrasonography areas, this echocardiography will play a crucial role. Why means echo is nothing but through some of the ultrasound waves we need to passes, it automatically taken an image of your heart chambers. Take example, left atrium, right atrium, and left ventricle and right ventricle. If may happen any kind of chamber related problems, it could easily analyze with the help of the blood flow. The blood flow color variations, it automatically analyzes through the ultrasonography. Ultrasonography is nothing but some of the ultrasound waves we need to pass in through the ultrasound probe. It automatically analyzes the blood flow color variations. It's called Doppler. Particularly, we're going to color Doppler effect in hospital science. color Doppler effect will play a crucial role to analyze any kind of chamber related issues, particularly blood flow blockages, and then particularly the patients who affected the way of valve related issues, or else these kind of blood flow chamber related problems may happen. It automatically analyzes through this echocardiography. So echocardiography is majorly we are using it in current hospital areas. This equipments also play a crucial role. So then, if going to the critical care department, particularly operation theatre, this heart lung machine play a crucial role. What is actually heart lung machine is? It is nothing but it is taken the way of heart and lung function by the machine. Particularly, they have given some of the external support, whether maybe the heart failure, whether maybe the lung kit failure, it automatically just runs with the help of the device. Your heart and lung can save with the help of some external support. That is, we are using this heart lung machine. We need to maintain the blood flow temperature, and then also we need to maintain how much pressure we need to deliver to the patients, and also we need to ensure whether maybe the problems who requires the external mechanical system support. This heart lung machine is not only for the one organ. This will replaces the heart and lung normal functions with the help of some external supports, because a heart lung machine will play a crucial role in upcoming days most of the critical areas. So for your today's participant and then your valuable session. Thank you very much. Thank you very much.